name is Ka, and I'll be introducing case number 1 that our group has. It is called Hygienist in the Middle. The case was located at Alvin Rosenblum University of Southern California. The case describes a dental hygienist that saw a patient for routine scaling in the office of a general dentist. She found a periodontal problem that had not been noted previously in the patient's chart. She explained to the patient that the existence of an abnormality and that she would have to talk about it with the dentist. She communicated to the dentist in private that the patient exhibits what she feels could be a moderately advanced stage of periodontal disease. The probing revealed numerous 6mm pockets, and the tissue was inflamed and enlarged. The dentist responded, "Don't worry, it has been that way for a long time, and I think we can maintain her with cleaning periodically." The dentist tells this to the patient and then moves on to another patient. The hygienist then tells the patient that she is not comfortable doing only a scaling, so maybe the patient should reschedule at another time with the other hygienist in the office. When the patient heard this, she asked what the hygienist would do if she were in this position. The hygienist replied, "I would see a periodontist." So there are 6 steps to the decision-making model, and step number 1 is to identify the ethical dilemma. In this case, the dental hygienist is concerned about the periodontal health of the patient, which was not previously documented. The information that was gathered during the routine assessment was presented to the dentist, and he basically suggested that a periodic cleaning will help the issue resolve on its own. The hygienist is uncomfortable performing only a scaling for this patient and tells the patient to reschedule with another hygienist. So should the patient reschedule with another hygienist to get her routine scaling, or should she take the hygienist's advice to see a periodontist? The ethical dilemma here is rescheduling the patient with another hygienist or with a periodontist. This is a decision that the patient has to make.
The second step of the 6-step decision-making model is to collect information. To fully understand or identify the ethical dilemma, more information may be needed in order to make an informed decision. In the scenario of the hygienist in the middle, the hygienist could further the conversation with the doctor to make sure that there is not a miscommunication and could inquire about at what point a referral to a periodontist is typically utilized in the office. The hygienist could also ask another doctor or another hygienist at the practice for a second opinion or about their experience with referrals while working at the practice. This information could further identify if the hygienist and the doctor's views and values do not align or if the specific patient's case is a gray area that can be worked past.
My name is Brianna, and I am going to start by explaining the options that we have for this hygienist here. Option 1, we can follow along with the dentist's recommendation and perform scaling. Option 2, we can explain to the patient that they have to reschedule with another hygienist. Option 3, we can tell the patient that they should see a periodontist after the cleaning. And option 4, discuss with the dentist the thoughts you have about the situation and what he would think about referring to a periodontist. So going back and discussing with the dentist, like, hey, I know you think this way, but let me show you her perio chart. Let me show you exactly what it is that I'm seeing that he may be missing, because we do need to remember that dentists do have a lot of patients on their hands and they do have a lot of things running through their heads, and sometimes we need to kind of like focus in and be like, hey, real quick, I just need you to hone in on this patient real quick and understand what I'm seeing. And then therefore, I think that overall the dentist should go with what the hygienist is saying. And then our 5th option is leave the practice. Hello, my name is Brianna, and I will be talking about applying the ethical principle to the options. So for option 1, we have following along with the dentist's recommendation. But this is breaching the patient's principal justice. Advanced periodontal disease requires specialized treatment, and a referral to a periodontist would better the chance of managing the disease, and we're not even offering her scaling and root planing. We're just like, yeah, let's just slap a prophy on it and hope that it's good to go, and then eventually she's going to show up and wonder why all her teeth are mobile. Option 2, which is having the patient rescheduled, does take the legal repercussions off of you. But what about veracity, being honest with the patient? Us hygienists has a duty to advocate the best possible care for our patients, and ignoring the periodontal condition can lead to ethical and professional repercussions. Option 3 is still doing the cleaning and advising the patient to see a periodontist after the fact. But again, why doesn't the patient get to decide what they're doing with their health, and why aren't they offered scaling and root planing first? This is going against autonomy. This patient should be able to explain, or should have explained to them their periodontal condition, how it's progressed, maybe figure out why it's progressed or factors on contributing, and then go from there. Let them decide on what they want to do. Do they want to try scaling and root planing first? Do they want to go straight to the periodontist? Option 4, which is discussing with the dentist again the situation and showing the dentist again what you see that he or she may be missing. As we know, our dentists have a lot of patients, a lot of things to do in a day, and if we are able to go, okay, can you please just look at this real quick, look at this radiograph, look at the loss of the lamina dura, look at these pocket depths, look at how much cal we have lost, and then the dentist should there and then go, oh, I see what you're saying, we should offer them this or this. And the dentist may have a valid reason for this approach, but at the same time, the dentist also could possibly be underestimating the seriousness of the condition, and it should just be discussed before just jumping into a prophylaxis on a patient that clearly needs SRP. And then option 5, which is not a very I would say, a hygienist in this position, they don't want to be in this position. They don't want to have to leave an office that they've been at because of the constant or, possible constant disagreement between the dentist and the hygienist. When it comes to this specific situation, I feel like if the hygienist is pulling out, look at this, look at that, and the dentist is just like, no, like it doesn't matter, then we need to reevaluate how we are treating our patients at this practice. The patients place trust in us as hygienists and our professional judgment. The hygienist suggestion of a periodontist could lead to better care and maintaining patient trust, rapport, and it would be a win for the dentist.
In step 5, we make a decision. The best choice will be option 4. Discuss with the dentist the thoughts you would have about the situation and what he would think about referring to a periodontist. While option 4 is recommended, it's essential to approach the situation with sensitivity and professionalism. Respectful communication with the dentist and consideration of their perspective are crucial for fostering a collaborative approach to patient care. Ultimately, the decision should be made in the best interest of the patient's health and well-being. In step 6, we implement the decision. Implementing option 4 involves initiating a conversation with the dentist to discuss concerns about the patient's condition and exploring the possibility of referring the patient to a periodontist.
So we've completed the 6 steps of the decision-making model. So then which category does this ethical dilemma fall into for this case? The ethical dilemma that this case falls into is called substandard care. Substandard care are situations in which there is failure to diagnose, failure to refer, or lack of proper infection control, or in which dental or dental hygiene services are provided that do not meet the accepted standard of care.